Losing bone mass, it's something we hear about, but many of us don't truly understand the consequences until we or a loved one suffer a broken bone, a fractured hip. It's a frightening reality, isn't it? That a simple fall could lead to a life-altering injury. The statistics are sobering. As we age, our bones become more fragile, and for millions of people over 45, this silent weakening, known as osteoporosis, can turn a minor stumble into a major medical emergency. But what if I told you that while bone loss is an inevitable part of a devastating fracture isn't? The good news is that you have the power to influence your bone health more than you might think. Today, we're going to look at 6 evidence-based strategies, from simple lifestyle tweaks to medical insights, that can help you strengthen your bones and reduce your risk of fractures. These are the same principles we, as medical professionals, rely on to help our patients stay strong and independent. Before we dive in, I want to hear from you. Have you or someone you know experienced a fracture due to low bone density? Share your story in the comments below. Your experience can help others feel less alone and more motivated to take action. Also, if you're finding this information valuable, please like this video and subscribe to Heartful Health After 45. We are committed to providing you with the lesser-known health insights that can truly make a difference in your life after 45. So, start with number 1. A principle so fundamental, it's called Wolff's Law. This law states that bone responds to the stress placed upon it by becoming stronger. It's a use it or lose it principle, which is why astronauts in a zero-gravity environment can lose bone mass at an alarming rate of 1-2 per month. The key takeaway for us? Weight-bearing exercise. This includes simple activities like walking, jogging, or even just standing. The force of gravity and your body weight stimulate your bones to build density. A great way to enhance this effect is by using a weighted vest. Studies have shown that wearing a vest weighing 5-10 of your body weight can increase bone density by 1-3 in the first year alone. Just remember to start slow and ensure you're doing it safely to avoid injury. The second strategy is strength training. You might be wondering, how do my muscles affect my bones? Well, your muscles are attached to your bones by tendons, and when you lift weights, the pulling action of your muscles signals your bones to build more mass. This process is called mechanotransduction. The best strength training exercises for bone health are compound movements that use large muscle groups, such as squats, lunges, leg presses, overhead presses, and rows. If you're new to strength training, it's crucial to seek guidance from a professional, like a personal trainer, to ensure proper form and prevent injury. Number 3 is a balanced diet, with a special focus on a few key nutrients. You already know about calcium and vitamin D, but let's look at them from a new angle. While the recommended daily intake for calcium is around 1,000 to 1,500 milligrams, it's best to get it from food sources like low-fat dairy, green leafy vegetables, and almonds, rather than relying solely on supplements which have been linked to some cardiovascular concerns. For vitamin D, the sun helps, but for most of us, especially as we get older and our absorption declines, supplements are a good idea. The recommendation is 800-1000 IUs daily, but check with your doctor to have your levels tested, as you may need more. Also, here's a tip. Taking your vitamin D supplement with a small amount of fat, like a handful of nuts, can increase its absorption by up to 50%. The third crucial nutrient is protein. Your bones are not just calcium, they are 95% collagen matrix, which is a protein. As we age, our protein needs can increase, so ensuring you get enough is vital for building and maintaining that bone structure. There is even some emerging research suggesting that collagen supplements might have a positive effect on bone density, particularly in postmenopausal women, though it's always best to discuss any supplement with your doctor. Strategy number 4 involves avoiding a few common bone-harming habits. Excessive alcohol consumption is a major culprit, as it reduces both estrogen and testosterone, hormones essential for bone remodeling. Smoking is another big one. The chronic, systemic inflammation caused by smoking has a clear negative effect on bone density. And finally, let's talk about caffeine. While you don't have to give up your morning coffee, Be mindful of timing. Drinking caffeinated beverages with a meal can reduce calcium absorption. So, try to enjoy your coffee or tea either before or after your meal. Number 5 brings us to the topic of hormone replacement therapy HERT. This is a big one, especially for women after menopause. Once you become postmenopausal, you can lose bone at a rate of 1-2 a year. HERT has been proven to increase bone mass and is one of the most effective ways to combat this rapid loss. While there have been controversies in the past, new research and a better understanding of the risks have led many experts to conclude that the benefits often outweigh the risks, particularly for women who are at high risk of fracture. For men, testosterone replacement therapy can also increase bone density if they are found to be deficient. Osteoporosis isn't just a women's issue. It affects 1 in 7 men, and hip fractures in elderly men have a higher rate of complications and mortality. So, if you're a man with low testosterone, this is a conversation worth having with your doctor. The final strategy is medication, specifically bisphosphonates. These medications are not for everyone, but for those with very low bone density or who have already suffered a fracture, they are incredibly effective. We have seen a lot of change in this area over our careers, and the latest research is clear. These medications work very well to increase bone density. However, there are potential side effects, including the ironic risk of an atypical femur fracture or osteonecrosis of the jaw in rare cases. Like any medical treatment, there is a risk-benefit ratio. For many high-risk individuals, the benefit of preventing a devastating hip fracture far outweighs these risks. A thorough discussion with your doctor or endocrinologist is essential to determine if this is the right path for you. So, there you have it. 6 actionable ways to take control of your bone health. You can start with something as simple as a daily walk or adding some almonds to your diet. The important thing is to start somewhere. Your health is your responsibility, and as we like to say here on Heartful Health After 45, every decision should be based on knowledge, not on fear or old routines. If this video has inspired you to be more proactive about your health, let me know by leaving a comment with a 1. We're here to unearth the truth, ask the difficult questions, and always put your well-being first. Thank you for watching, and stay healthy.